Hi, everybody. Welcome to another episode of the Beyond the Pivot podcast, a podcast that brings you insights, golden nuggets, everything good about what's happening across Africa in the startup ecosystem space. Today, we're grateful again that you joined us, and thank you to everybody, the 35 subscribers that we have across the different platforms YouTube, Spotify, Apple Podcasts. It really means a lot that you join and listen in. And also, your feedback really matters. We value your feedback on how we can improve this podcast and make it better and provide you with a lot more relevant information. Martin, how's it going and how are you doing?
Thank you, Kabwela, for the intro. And I have to say, it's a good day. It's a winter in here, so the temperatures are dropping dangerously to zero, more than I like it actually. But it's overall, it's life, So if you survive the winter, there is always some sun at the end of the tunnel, which is the summer coming up and the spring. So I'm doing fine. Thank you for asking. Today, we're going to be talking mostly about health tech and logistics. Healthtech will be introduced by Kabwela. We will be talking about how the sector looks like. He will bring us some news from the African startup ecosystem, mostly balancing on the last year. And then we have a great interview with Mwansa Chalo, who is the founder of Duniya Healthcare, who's going to talk to us about his story, how he came with the idea, how he's tackling this giant problem, and what maybe you guys can be part of as well. So before we get to the interview, Kabwela, would you mind sharing with us some news that are happening in the African ecosystem right now?
Absolutely. And just so you know, Martin, for our guests, I'm excited about this episode because for some that may not know, Chalo was once my co-founder for one of the first companies that we built together, which was Sportless Africa. So he's a great friend as well, and I really believe in the mission that he's driving and what they're trying to solve at Duniya Healthcare. But before we even get into that, I think we can just give you a recap. It would be nice to just have a recap of what funding looked like in Africa last year, which was 2024. There was an episode where we talked briefly about what the stats we're looking at, but a recap I think will be really relevant for us to just understand investment across Africa. So 2024 total funding for African startups, we had $2.2 billion in funding. Yes, it is quite significant. Excited a bit, but this is a 25% decrease in funding compared to 2023, which was at $2.9 billion. Equity investment stood at 1.5 billion US dollars, which is a drop from about 11% compared to 2023. And then debt investment as well, while it made up a total of 30%, that's a drop compared to 2023, where the total investments that were made in African startups, 38% of that made up the debt. As mentioned, this was quite a global trend, and we've seen other markets and ecosystems experiencing the same. For example, in Europe, we saw startups raising a total of about 45 billion, and compared to 2023, which was 47 billion. So there was a $2 billion drop. And it's interesting that the drop in Europe, maybe it's the one that came to Africa, Martin. You can tell me, because we have it at 2 billion and Africa receiving 2.2 billion. Looking at the trend from 2021, it's almost like there's been a very significant downtrend where startups in 2021 raised 100 billion, 101 billion actually, and now to 2024 where only 45 billion was secured in funding. So Martin, yeah, that's what it looks like from an African continent perspective and just in comparison to other markets like Europe across the globe.
It's always interesting to see it in a comparison. So we know of what's happening in Africa is isolated, and it usually is not because it's a globalized world in the end. So there's always some kind of uh, effect of what's happening in Africa and Europe and and the vice versa as well. So thank you for the stats about the 2024 and the trends the startup funding is going through right now. And to be a little bit more timely, is there anything that's happening in the startup funding world right now that you would like to share with us?
Yes, absolutely. There's always news happening on the African continent. And in closing, since we're talking about fundraising and today's conversation being about healthcare, I would like to just spotlight PBR Life Sciences, which is a Nigerian startup who recently closed their pre-seed funding of $1 million. And this funding round was led by Launch Africa, Octera Capital, and others as well that participated in the round. So, who's PBR Life Sciences? They are a health tech startup that's revolutionizing healthcare by providing fast, high quality, and real world data and insights to various medical services providers and pharmaceutical organizations. With the funding that they have received, they are seeking to scale their service, which is data as a service, and an analytics platform in Nigeria, Ghana, and Kenya. So pretty exciting news on funding across the continent. And today I'm super excited again about this particular interview that we have. And I'll throw it over to Martin to take us through to today's episode.
Thank you, Kabwela, for the exciting news and for telling us a little bit about the health tech sector in Africa. And to follow up our interview with Mwansa Chalo, that is coming up from Duniya Healthcare, it's going to be a little cross-sector business interview since he is in logistics, but also in healthcare in the same time. But let's not wait any longer and let's get to it. And today we have our special guest, Mwansa Chalo, who is the founder of Duniya Healthcare. Chalo, welcome. Welcome to Beyond the Pivot.
Thank you, Martin. I'm quite excited to be here. I've been looking forward to it. So yeah, I think it's going to be a great conversation.
Like you said before we start recording, a conversation between friends. So hopefully we're not going to turn into enemies by the end of it.
Not at all. Yeah.
To put into perspective of what you do, you are the founder of Duniya Healthcare, which is a business that has been in existence for the past 2 years, if roughly two years. And you are revolutionizing how pharmaceuticals and medicinal drugs are distributed between, let's say, the outside world and Zambia, and then within the Zambia as well. So it is pretty specific field to be in. You have to have some journey behind you that took you to this space. So could you tell us what was the journey that took you to the decision you'll be revolutionizing how medicines are distributed across Zambia?
Yeah, that's a good question, Martin, and thank you again. I'm quite excited to be on this platform today. And like you said, I think for me, when I look back, two things happened, right, for me to land where we're at today with Duniya Healthcare and trying to transform supply chain for pharmaceutical products. So the first one is that, so I come from a family that's been doing, that's been in the healthcare space for over 30 years, right? My mom is a retired nurse now. She's retired, but she's been a nurse midwife pretty much her entire life. And at several points during our lives, we've owned some healthcare business. My mom quit her job in the government as a nurse in the government to start her own private clinic. Just about 2000, she started her own private clinic, and we would see how she would be dedicated to ensure that that business grows and is able to serve the community in Kalurushi, which is a bit north of Zambia. Then later on, she also started her own chain of retail pharmacies in Kitwe. And so during my formidable years, when I was in my teen years, we used to always hang around the pharmacy, right? So every time when I knock off school, I knew that immediately I knock off school, I would have to go by the pharmacy, help out, whether to be as a cashier there, whether it's cleaning or sweeping, whatever it is. So the entire family would be involved in the business. And so every now and then, my mom would do this thing where, because she was the main person at the pharmacy, she would make orders to the suppliers, the wholesalers and manufacturers for pharmaceutical products that she needed for her pharmacy. And she would make orders just by calling them and telling them, I want 1, 2, 3, 4, 5. 10, 15 things, right? And then she would always ask me to go and pick up the stuff for her from the wholesalers because she can't leave the pharmacy, So I would then go and pick up the stuff and bring it to the pharmacy, and we'll do the stock take and everything else together. So that was then. And then later on, I graduated, went into university, did my degree in economics. And then after that, I decided to venture into entrepreneurship full time. So I moved away from the family business and started my own business, went into cleaning services and whatnot. Then later on, after I exited the business that I was doing, then I had a conversation with one of the Catholic sisters that was managing one of the rural health centers in Zambia. So the Catholic Church has got mission hospitals and clinics across the country in rural areas. And she told me a story about a young girl that was 17 years old and heavily pregnant. Her name was Chipego. She was 17 years old and heavily pregnant, and visited her facility. And Chipego went to her facility. They could see that she had all the signs and symptoms of malaria, but they could not do any malaria diagnosis test because they had run out of test kits. And she told me that, look, even if we did the test, we couldn't give her any malaria medication because we had ordered for the medication a month before, but it had not yet been delivered. And she told me that, unfortunately, 3 days later, Chipego and her unborn baby died. So when she told me this story, I thought about it for weeks and weeks and weeks. And I kept going back to, that job that mom used to give me voluntarily, where I would go and pick up medicine for her and take it. And I kept thinking, how is this still a problem? Some 15 years later, how are we still having this problem? How has nobody actually sorted out this problem in this industry? Especially because it's such an important thing, right? So it borders on life and death. You would think that a lot more people would put energies into solving this particular problem. And so started doing a little bit more research around logistics in the pharmaceutical space, and found that about 3.5 million Africans die annually due to lack of access to medication. That's 3.5 million Africans that I think die needlessly and senselessly because of inefficiencies within the supply chain of pharmaceutical products. And I thought, this is a big problem, and I think it's worth taking up and trying to solve. And that's how we came up with Duniya Healthcare, to try and solve problems of access to medicine within Africa.
Oh, thank you. That's very broad, and I think we can end the podcast now. Now we know everything. But if you have to dive a little deeper, the question comes to my mind: what was your first kind of like MVP? How did you test out that your solution that you are bringing is the right one for the situation? Because I feel, as you said, it's a giant problem, and the giant problem could be a little different in every of those countries that are across Africa. That the supply chains look different, distributors are different, maybe not even the Catholic Church runs in the other countries. So what was the minimum you thought is a good idea to do to test out you are approaching it from the right angle?
Yeah. So we did several things when we had started out, and we didn't obviously have the application up and running, and we had to do everything manually. And I remember the first thing that I did was, before I had even fully conceptualized the idea, I have a friend of mine that has a retail pharmacy, right? And he had just started, he had just applied for a wholesale license, and he just got it. And I said, look, I've got this idea, and I think that I could help out with the distribution. There's a challenge around distribution, right? But I need to test the market. So what I would like you to do is give me 10 items I think I told him 20. Give me 20 items that that people frequently buy, right? That you as a retailer, you frequently buy from wholesalers. Like, these are fast moving stuff, right? And give me a wholesale price for it. And I'm just asking for a small markup on it. And I think I asked him for like a 5% on it. And I said, let me try and get some clients and, and see if we can source products for them. And so he said, okay, yeah, we'll game. And he gave me a list and gave me prices as well. And what I did was I went into, I stay in my neighborhood, it's in Charleston, right? And there's like 15 retail pharmacies. within maybe like 3 kilometer radius of my house. So I said, okay, yeah, I've mapped all of them out. Let me go and start trying and seeing if this is something that they would like to get, So I went into the first one, had a chat with them. As usual, most of these pharmacies, when you go to see them, the owners are not the ones manning the pharmacies, so the decision makers are not there. But I still had a chance to have conversation with the pharmacists at this pharmacies to find out how do they do their ordering, what happens, and I showed them like you could have a list like this one, and then you could order from us, then we can come and deliver to your doorstep. And so the one pharmacy where I found the owner, the pharmacist that was there just got the paper that I had with a list of prices from my friend, and he took to the owner. And I was just using that for conversation as survey of sort, right, to get feedback. And then when the pharmacist came back, he came back with the owner of the pharmacy, and he came back with an order saying, I'd like to get this, that. I was like, wait. He's trying to get feedback. So then immediately, that's when I had my first order. And I called my friend and said, look, I already have an order for this thing. I have this pharmacy that wants 1, 2, 3, 4. Can we quickly get them? He said, okay, fantastic. Rushed all the way to town center to try and get them, because he also, remember, he was just starting out his wholesale, right? So he also didn't have the products. So he just knew where to get the products. So he started making the phone calls. I went and picked up from the wholesalers and delivered. And I think because the whole process was, all over the place and we're not ready for this order, it took us long to actually fulfill that order. And I think I delivered it like 18:30, almost 19 hours thereabout, but we did actually manage to deliver. So that was the sort of MVP that I started out with, and that for me proved that there's an actual need here. There's an actual problem, right? And we need to figure out how to make it more efficient for people to access medicine, especially the retailers, the businesses that are saving the community. If we can find ways for them to be more efficient with their time. Most of them are spending about 8 hours on a weekly basis of labor hours on a weekly basis just to do procurement, sourcing, and logistics, which can be used to actually save the community better. So that's the kind of MVP that we had. So it was all, very, very manual in terms of ordering systems. Yeah.
You said you delivered it at 7 p.m. It's like that's long time. That's the same day delivery. It's what Amazon stands for.
Same day. Yes.
So I think it's still pretty good, Don't take it too harshly.
But it was one order. It was one order.
But the first one, that one should be the toughest to get, like you say, and the biggest chaos, and still it was the same day delivered. Impressive. How does it look like now? So we saw. We heard that the first order was same day delivered. You running around with paper, people giving you feedback, and maybe making that first order. How does the system look now after 2 years?
So there's a lot that has happened. I think over time we still have both the online platform and we have the bit of a manual platform as well that we're working with, because largely what you get to find is that it takes some time, especially in Africa, for people to adapt to new technology, right? So you always have to make room for that, right? In as much as you'd like everything to be done seamlessly online and whatnot, usually that's not the case, right? You'd find a few people that will be able to use the online version of it, but you also have a manual system that is going on in the background. I think the key part is the technology just helps you become more efficient with what you're doing, but the process has to be able to work. And I think that's largely what we've been doing now. So we still have a bit of an integrated system. We've got 2 systems that are currently running, one for the rural areas and one for the urban areas. So remember, I haven't mentioned this already, but we have a contract with the Catholic Church to distribute pharmaceutical products across the country to their 75 mission hospitals, which we had signed sometime last year. And So what we're doing is, for them, it's a completely different system from the urban areas because we are aggregating orders. So it's a demand pool kind of situation where we aggregate the orders from the facilities that the Catholic Church has. And then the wholesalers or suppliers get to then bid for those products, which are given to them in bulk. So we have that system that is completely running. That one, for most of the facilities, strangely enough, the facilities in the rural areas have been able to use the platform almost seamlessly. The difficulty is with the urban areas, right? But the rural areas, but also it's a bit easier to use, I think. So they are able to plug in their orders, and we do that online. We aggregate, then the suppliers get to bid for those orders from the Catholic mission hospitals, and then we have the urban side, which is now where the retail pharmacies are able to order products from various wholesalers, right, various suppliers. So when you get into our platform, you'll be able to see different suppliers for pharmaceutical products, and you can order your stock for your pharmacy from there, and we get to do the underlying logistics for that as well. So a key part and a key variation that we have currently is that the kind of revenue model we have is that we get to charge the wholesalers and not the retailers. So which is quite key and different in terms of the industry and what we're doing.
It's interesting that that there is such a thing as hospitals run by Catholic Church. I don't think we have that in Czech Republic. I don't want to I'm not 100% certain about it, so I don't want to claim it's true, but I haven't heard about it.
It means that your government has been doing what the government needs to do, right? And you need to understand, and that's a thing I think when I talk to investors as well from Europe and Japan. Interestingly, I mentioned Japan because there's an interesting story with some investors that I was talking to from Japan, and I was explaining all of these different things that we're doing, and they kept asking me the same question about 3 times, right? And I didn't get why they were not getting it right until somebody in the meeting room said there was a Zambian, I think from UNDP, that was facilitating the meeting, and says, no, Chalo, let's take a step back. I think the question is, how is it that the government hospitals do not have medication? I don't think they understand that. Then it clicked, because where they're coming from, the government or public hospitals are always fully equipped with, all the medicine that they use. So they can't imagine that you go to a private retail pharmacy to actually get medication that you're supposed to get from a public hospital. So I think the dynamics are different in Europe, in Asia.
Yeah.
And in Africa, the Catholic Church came up with the mission hospitals because they work a lot in the rural areas, but they found that there was no healthcare delivery being done in those areas. And they said, you know what, we can't wait for the government, let's do this. And they set up this hospital. So they're quite big. They're quite big in Africa.
And are there other denominations of Christianity or Islam that run their own health facilities? Maybe not just in Zambia, but I assume Tanzania is more Islamic country, if I'm not mistaken. Would you then have to work with, I don't know the denominations of Islam, so like Islamic providers that run these hospitals then?
Yeah, so I'm not aware of Islamic denominations that own hospitals. I think there could be, but the ones that I know of are other Christian denominations aside from the Catholic Church. So the churches in Zambia have what they call the Churches Health Association of Zambia, which is shortened for CHAZ. And it's basically all of the churches that have got these health facilities coming together and, trying to figure out how best they can work together to give access to healthcare in these rural areas or areas where they work. And in Zambia, there are about 150 facilities owned by Christian churches, and but 50% of those are owned by the Catholic Church. Then you have other churches like, I think, the Seventh-day Adventists, you have the UCZ and all of these other denominations. But the Catholic Church obviously is the biggest one.
And do you think once you can prove yourself with this network of church running hospitals, then the next steps would be to work with the government, or government hasn't shown any interest so far to also stock their hospitals with medicine.
Yeah. Well, so I'll tell you this. I think we are gonna build the second biggest network of distribution for pharmaceutical products in the country. Second only to the government, and that much I'm sure about. Once we're successful with this particular project we're doing for the rural areas, it's gonna be a vast network. It's gonna give us scale, and with the efficiency that we are bringing through with the technology and the logistics system that we're building, it will be, I think the government will want to use us, because of the efficiencies we bring through. The government has been struggling a lot, and I think we see it in the papers every other month with the supply chain for pharmaceutical products. There are issues from the sourcing part, the procurement, and the distribution. There are so many things that are not working, right? And just, about 2 months ago, there were a couple of dozens of containers full of medicine that were marooned somewhere, in the country without the Ministry of Health knowing about it. But they were thinking that the medication had reached the facilities, but you had containers of medication that were seated, being marooned somewhere for over 6 months. So it's a complete mess, But that's what partnering with the private sector gets to do, right? It will bring in some level of efficiency, some level of technology advancement, and I think that's what we'll be able to do in the market. And I think we're going to build something pretty significant.
So if I'm a distributor from outside of Zambia, what would be your pitch to me to work with you? How does that whole process looks like?
Yeah, so healthcare is a bit complex, right? It's a bit complicated, and right now we are not dealing directly with say manufacturers of pharmaceutical products that are outside of the country or even outside of the continent. And largely because of how supply chain for pharmaceutical products is structured, it's very different. And when you get, you kind of like have to understand how the pieces move for you to actually get it. So there are 4 main parts to supply chain for pharmaceutical products. That's if you're looking at it from the manufacturer to the end user, who are the patients, right? So you have the first part, which is the manufacturers, who manufacture usually from Asia, India, or Europe mainly. Those are the 2 main places we're getting our medicine from. And you might know that in Africa, we consume only about 5% of the medicine we consume in Africa is locally manufactured. So about 95% of the medicine is all imported from outside of Africa. So you're sort of like juxtaposing that with Europe, which has like about 51% of locally manufactured medicine that is consumed there. So meaning that a large part of it is getting the medicine from the manufacturers in Europe and Asia into the African country. And the people that get to do that are the distributors, right? And then for you to be a distributor, you need to understand that you need to get a license to move that medication from the manufacturer to the country that you're moving it in. So if I was going to import from maybe a European manufacturer, I need to get each and every product licensed, and say, okay, I'm going to be importing this. Can you check it? Can you do all of the efficacy tests and whatnot? And then once I get the license, I then get to move the products into the country. So then you find that after the distributors, you have the retailers or the dispensers, right? Which are the retail pharmacies, the hospitals, and the clinics. They're the ones that then get to dispense to the end users, who are the patients and the users of the medicine. So now, in that whole thing, the biggest chunk of the work is with the distributors, right? So right now, we do not import anything from outside. We're just trying to make logistics efficient at national level, right? Like the medicine that is already getting into the country, how can we make sure that the distribution of that medication is done efficiently? We do have ideas of how we can better improve the movement of medication from the manufacturers outside of the continent into the country, but we are not yet there in terms of implementing itself. So my pitch would be, I can connect you to some of the big distributors we have in the country with good licensing that can actually help us get the products into the country. And once the product is into the country, we are able to make sure that we distribute the products nationwide. So, yeah.
What was the appeal from the distributor side to work with you directly instead of directly with the the, how do you say it, the alliance of the church hospitals, health providers, the CHAZ? Why do they need you as the middleman then?
Yeah, that's a good that's a good question, and I think that's one of the first questions I had to ask myself was, why should anybody pay me for doing this job, right? And a few people that are outside of the healthcare industry, I found that when I told them of this idea, a lot of them would say this thing won't work because the distributors are already able to get to to the retailers and whatnot. But when I talk to the distributors have a challenge. They are completely overwhelmed. Okay, their logistics systems are not efficient enough to get the products to the retailers, and they are losing money because of it, right? And so when I come through and tell them to say, look, I can give you market access, right? The contract I have with the Catholic Church is a no-brainer because I'm aggregating, nationwide, all of these orders from different mission hospitals, which they do not have currently. I'm bringing it all together as one, and I'm giving you access to this particular contract, which is worth several millions of dollars, right? And so I'm giving you an opportunity to tap into this market. So that's a no-brainer for them, for the distribution across into rural areas, because they don't have the logistics infrastructure. They don't even have the demand to be able to go into the rural areas, right? So one of the biggest issues you get to find is that in the rural areas, it's not commercially viable for an individual wholesaler or distributor to go and set up camp or shop in the rural areas because of the way that the demand topology is, right? Where the demographic is that there's the population in the rural areas is very small, but also sparsely populated, right? It's all over the place. And so it doesn't make sense if I'm bringing a product here where there are just 10 people and then I'm traveling 1,000 kilometers to bring the product, right? But what I'm doing is I'm aggregating that demand, okay? I've seen there are pockets of demand here, pockets of demand there. I put them all together and say, look, I can distribute to these all of these facilities efficiently. Okay, so I'm gonna bring this demand that I've aggregated and bring it to you so that you can service that. It's a no-brainer for the wholesalers, right? And I'm doing the underlying logistics for it, and they're happy to pay us for that.
I mean, you are making their order bigger and with less work, so it makes sense.
Exactly
how you explained it. It seems like it's been a long road from that one sheet of 20 medicines running around your neighborhood to this phase you are in right now. How hard was it to persuade investors, and how long did it take you to get somebody? Because you mentioned several times that you talked to investors from Japan, from Europe. I assume you talked to investors from Zambia as well. So how was the journey on this side, and how much money did you need in the beginning to start get this ball rolling?
Yeah, I think talking to investors is always a big challenge, whether locally or internationally. I think world over, you get to find that for you to just close a good round, especially if you're doing maybe a pre-seed or a seed round, you'd have to talk to probably hundreds of investors that most of them, probably 90% of them will actually say no to you. So yeah, when we started out, we started off just bootstrapping the business, but then I decided to do after I had some form of proof of concept. I decided to talk to a few friends and see if we can put some monies together for us to start this thing up. And so I started talking to just my friends that are working, trying to convince them to to partner with me. And I think I probably would have talked to maybe about 30 of my friends, and I think only 2 of them, had enough money to even just, let go of and say, okay, I believe in your dream, let's actually do this. But lucky enough, I also had some savings from my previous business as well. So I used part of that to to get the ball rolling in the very beginning of that. And then afterwards, I did an extended family and friends round where now I talk to different investors from Europe, from Japan, from Asia that were willing to tap into, more like angel investors really, that were willing to pump some money in. So we had raised, I think the first round of investment was about just a 25K that we had gotten, and then we did another bridge of about, we were asking for about 15K, but ended up being about 16K. It was completely oversubscribed. But just to get us to a point where we are now doing a pre-seed round, we're now at a point where we're raising 500K in pre-seed. But for us to get to this point, we first needed to ensure that we have a problem solution fit, right? To be sure that the problem that we're trying to solve is an actual problem, and the solution that we're providing is, the correct solution for the market itself. And I think that's what that family and friends round did, and it gave us very good traction. Just last year alone, we had moved over $1 million worth of medication, and I think that's traction enough for us to confidently say, we're now willing to take venture capital money because we think that we are able to give in good financial returns with the business itself. So it was extremely hard in the beginning, extremely, extremely hard. You think that maybe you could get some investments locally, but it's difficult to get investments locally, partly because most of the investors that you have, you're competing with very high interest rates, right? In Africa, you have interest rates on bonds and loans that are upwards of 19%, right? On average, upwards of 19%. So if I'm going to talk
19% per year or 19% per month?
No, per year. So the formal market, that's 19% per year. Okay, upwards of that. And so mostly when you're going to a bank, or when a bank issues out some form of bond, they would probably be giving you interest of about 25%, right? Thereabout annually. But that's like in the formal market. In the informal space, you have people that are charging as much as 10% on a monthly basis. Okay, so now those, meaning that for an investor, and if there's a company that is, say, dishing out loans at 10% on a monthly basis, they think that they would get much better return investing in something like that, or in some bonds, or even government bonds, which have got very low risk, right? They've got low risk, but you're getting maybe like 23% interest annually, right? With almost zero risk. And then you've got a Chalo here that comes up with a very high risk business that's in its very infancy, and the risk is just high. Yes, the returns could be a lot higher down the line, but the risk is certainly higher. So you're competing with very high interest rates, so it's very difficult for you to then convince the local investors to say, some of this money, can you pump it into my business so that we can grow? And I think in economics, we would call it the crowding out effect, right? Where you see that the government puts out these bonds at very high interest, and then what ends up happening is that they mop out all the cash that is supposed to go into the business, and it goes into the government. And that's what you get to find locally. So a lot of what we resorted to was to try and now get investors from outside of the continent, that where the playing field is much better when you look at the interest rates. So yeah, so that's been the key change and the key drive as well. So it's been a lot of us trying to get investment from outside and bring it in locally. Yeah.
So I have a question, two questions. One is about since you got the investors from the outside, did it play any effect on persuading maybe the local guys? Because I know Kabwela, in one of those episodes that we already had, mentioned that some local investors match what you already funded somewhere else. So if this is viability for everybody, or maybe if it's just like a big amount of money, like big rounds. And the second question is exactly what role did in your fundraising, or maybe in your journey, played these programs from UNDP and Bongo Hive in Zambia, or maybe if you attended something else as well that help you to get not only from your previous businesses but also in this business from like that one sheet to now distributing to so many pharmacies and hospitals?
So I think that's a program that one of the funds have. There's an African fund called the Catalytic Fund, and I think they work with what they call business angel networks in Africa. And when those angel investors decide to invest in any business in Africa, then they will be able to match up whatever they invest. So the key would be to try and get those local investors that are registered with the Africa Business Angels Network. And then once you get one of those paychecks, then you could apply with Catalytic Funds to match that. So it's a very isolated fund. It's not like it's the complete norm everywhere, all right? And so you see that there's a lot of competition for that fund, right? Because then if you get a local investor that's registered, then you could possibly unlock some more funding with the other one. So it's it's not the easiest of routes, but yeah. It does.
So it has to be a local investor invests you. It couldn't be people from outside invest you to qualify yourself for this fund.
Yeah. So it has to be a local investor, that not just any local investor, a local investor that's registered with that particular network of investors. Yeah. So I think it's a way that they were trying to push up, because I think it makes sense, right? If you're gonna get money, it would be nice if the local investors can actually put money into local businesses, right? Because then we have more people locally that have got more skin in the game. And hopefully, I think maybe a couple of years down the line, this is something I'm hoping we could be able to solve. If we manage to make a good exit, not even if, but when we manage to make a good exit with Duniya, maybe we could try and see how many other startups we could fund locally, because we obviously understand some of the challenges that are there as far as raising funding is concerned. So, yeah.
It's always about the first generation, and then it gets easier for the second and so on, right? Of the founders.
Absolutely. Absolutely.
Because
so I ended up talking about the investors. There was a second part to your question.
Second part to my question
about
was the role of
the programs.
Exactly. The programs, UNDP from Bongo Hive, if you took anything else and so on.
Yeah, I've done a lot of programs. My goodness, I'm a student. I'm a perpetual student. I'm always learning. And I've been privileged enough to be in an ecosystem that I've seen grow. I've been doing this entrepreneurship thing for close to 10 years now. And so when we were just starting out, it's completely different from the way that it is now. We used to struggle in the beginning because you didn't know what you didn't know. You didn't know where to go to get information. But now we've seen a lot of innovation hubs get to pop up, and a lot of accelerator programs come up as well. When I just started at idea stage, in fact, before I had actually even fully registered the company, I got into an accelerator called DigiLogic. Which was an accelerator for logistics ideas in Africa. And I think it was in partnership with, I think there were a couple of them. There was a Finnish organization called VTT, and in partnership with Bongo Hive and other accelerators within Africa. And that just opened me up a lot in terms of what I need to look at in terms of logistics. We had conversations with people like from DHL, FedEx, these big logistics companies, understanding how they've managed to build what they've built, and it was just mind blowing altogether. I've done other accelerators as well with Bongo Hive. I think I've done like 2 or 3 of them. I've been forgetting them now, but we've had like different sessions of these things. So it's really, really helped.
So what do you think, if somebody is listening to us who is thinking about solving some big problem like you are, how should they start? How should they distill it to something they can do before drowning themselves in that impossibility of solving it?
Yeah, I always say just start. there's more, you get a lot more information from action, right? When you begin to do something and work at it, then you get a lot more information and you even get a lot more confidence in what you're trying to do than just sitting back. Just start unprepared, start sloppy, just get started. That's just the key. And then, one step at a time, and you see that the world will start opening up for you as you go. So just get started. Whatever business idea it is that you have, don't wait for it to be fully formed. Don't wait for you to have all the technology ready. Don't wait for anything. In fact, don't even wait for investors. Don't wait for anything. Just get started. Get onto the ground. Talk to the customers. Understand them. Get feedback. Try and sell to them. Sell them whatever it is that you can. Sell to them and get feedback. And I think that's the biggest advice I could give.
So you started, you joined a bunch of programs, and you made a quite big impact already with $1 million worth of medicine to be distributed efficiently. Where do you see yourself and Duniya within, let's say, next 2-3 years? Are you planning anything major that you are kind of afraid of but excited about?
Yeah, we are quite working on a lot of big things, and I'm excited about the technology that we are building, particularly for the healthcare industry. I think it's going to be completely transformational, and I think within the next year or two, with the project that we have, distribution around the country nationwide, once successful, I think we could be saving as much as 2,000 lives annually. That's a big number. Every time I think about that number, I get jitters. I get butterflies in my tummy, and my hair stands all the time, because 2,000 lives is not a small number. And if we could just build this technology and work out the logistics system efficiently, we could save a lot of lives. And that's just within the next 2 to 3 years. And I think we could. Whilst doing that, we could make some very good returns for our investors, and I'm super, super excited about that. I always think that, healthcare is one of the few industries where you can do good and do great for yourself, both that moral imperative and the business imperative as well. The moral imperative to save lives, to help people, give people a dignified life, but you also have that business imperative to give, good financial return, and it has this perfect blend of the two in itself. So I'm quite excited about that. I think there are talks of very good expansions in another African country, and we'll be able to see that. I think in the next less than 2 years, I think we should be able to get foot into that. There are big opportunities as far as healthcare is concerned in Africa, and we are ready to take them up.
It's always good if the goals are big, but you know the road to it, and if they make you a little afraid, but also excited about. So I'm glad we get to talk to you today, Chalo. And if somebody wants to talk to you personally, not just through me, how can they reach you? Where they can find you?
So I'm on LinkedIn. You can check me out. Mwansa Chalo, you find me. I think there should be a smiley picture of me there. You can also get me on pretty much all the socials, on Facebook, on Twitter. I'm there as well. But you can also send me an email. Drop me off an email, chalo@duniyahealthcare.com. And yeah, we can get talking. I think I'm quite excited to have conversations with different people and see how best we can impact Africa.
It's true. I have never seen you not smiling. So every picture of you is a smiling picture.
Yeah.
Which always brightens my day.
Of course.
And if anybody wants to join the mission of saving more than 2,000 lives a year just by supplying them medicine on time, please do not be afraid and reach out to Chalo. He is a very friendly guy, as you can say, and he will provide you very good information and smile at you. So thank you very much, Chalo, for being our guest today. Do you have any last message you would like to tell people that are listening?
Thank you. I think for everybody, I know that this is going global, and we have people from all over the world that will be listening and watching to this. I think there are great opportunities in Africa. I think the African economy is rising. Let's work together and see how best we can improve the African economy.
Thank you very much for the message of hope. And to everybody listening, we are very glad you were with us today. And we we know that you will join us in our mission of introducing and listening to African founders who make the world a better place.
Thank you so much for joining us on today's episode. Our amazing emerging founder, Mwansa Chalo, all the insights that he's shared. We hope that you're inspired. You are inspired and informed as well as you embark on your entrepreneurial investment journey on the African continent or wherever you're listening to us from. And please, if you've got any feedback or ideas, or you'd love to see a guest on this particular episode, reach out to us on and connect with us on social media. I'm very active on LinkedIn, but please, Martin, you can tell us as well, where can they find us or where can they find you, or more information about the Beyond the Pivot podcast.
Thank you, Kabwela. You can also find me on LinkedIn, on Martin Vitek. And do not hesitate to give us feedback also on our new website, beyondthepivot.org, where you can find not only all the other older episodes, but also the contact information on us as well. So do not be shy. Share this podcast with your friend, with your mom, with your uncle, with your best friend. And let's keep this community growing. And let's bring you more stories from going beyond the pivot.